Hello, everyone. I'm very excited to be here. My name is Christine, and I'm a rising fourth-year medical student at Yale. And thank you so much to the Acne and Rosacea Society for having me speak today. I have no conflicts of interest to declare. Okay, so I will be reviewing hidradenitis suppurativa and endometriosis. I will discuss the implications of menopause on both diseases, review the cross-sectional study that we conducted in postmenopausal patients, and discuss these findings and implications for, future studies. So hidradenitis suppurativa and endometriosis are both chronic and painful life-threatening diseases in female patients. And both of these diseases experience diagnostic delays in many cases, and this leads to downstream effects in patient outcomes. So HS is a chronic inflammatory dermatosis characterized by recurrent skin nodules, abscesses, and draining tunnels in auxiliary regions, inframammary, and anal-genital regions. The estimated global prevalence is about 1%, and onset is typically in the second or third decade of life. And HS pathogenesis is complicated and multifactorial with innate and adaptive immunologic dysfunction, genetic factors, and environmental factors, most commonly being tobacco smoking and body mass index. Endometriosis, on the other hand, is a chronic gynecological disease characterized by ectopic endometrial tissue. And it typically causes pain, dysmenorrhea, dyspareunia, and infertility. And its pathogenesis is also complicated and multifactorial with innate and adaptive immunological dysfunction. There's also a very strong endocrine dependence, particularly with estrogen, and environmental factors as well. Now, for menopause, we know that all women will undergo menopause sometime in their life, and that during menopause, there is a large hormone shift, which in the literature has shown to lead to increased risk of developing chronic disease in postmenopausal patients. And for both HS and endometriosis, menopause can actually alleviate or worsen symptoms for reasons that are unclear. So far we know that both HS and endometriosis affect women, and there's a general lack of awareness and stigma with the associated symptoms, which lead to diagnostic delay. And that there are changes with menopause that we don't fully understand yet. So we decided to conduct a cross-sectional study using the NIH All of Us research program, which focuses on traditionally underrepresented populations in medicine. We used female patients over 60 years old with electronic health record data available. And we performed Pearson's chi-squared test and one-way analysis of variance to compare HS cases to controls without HS. And then we conducted logistic regression, univariable and multivariable, adjusted for these factors right here. So first, we found some interesting differences between our controls and our HS cases. First of all, being in age, we found that our HS cases had a mean age of 65.8 compared to 69.3 in controls. And for race and ethnicity, notably in the HS cohort, 42.5% are African American versus 18.3% in our controls. And for income data, we found about a third of HS cases had income under $25,000 compared to 22% in the controls. However, looking at the literature that has analyzed the demographics of hidradenitis suppurativa patients, we find that our findings are in line with what's been previously published. And so for endometriosis, we found a statistically significant prevalence that was increased in our HS cases compared to our controls, that being 7.7 in HS and 2.7 in our controls. In our univariable regression, we found an odds ratio of 3.03 with a statistically significant confidence interval, 1.9 to 4.5. And we adjusted for demographics, smoking, body mass index, PCOS, cardiovascular disease, and type 2 diabetes. And our odds ratio was attenuated to 2.62% with a confidence interval that was still significantly significant at 1.5 to 4.22%. So we know that in menopause, there is a large decrease in ovarian production of estrogen, which consequently alters the estrogen to androgen ratio in postmenopausal patients. Though this is counterbalanced by the production of peripheral estrogen. So this happens via aromatase. And interestingly, the literature has shown that excess adipose tissue may actually increase the conversion of peripheral androgens to estradiol via aromatase. And we know that in HS, obesity is a well-established comorbidity. So with this excess adipose tissue, this may very well be happening in HS patients. But if not, we do have two categories here. So for those patients that are having more of that production via aromatase, we have high peripheral estrogen, versus those who do not, we have low peripheral estrogen. So estrogen has been shown to be an immunomodulator of cytokines that are implicated in both HS and endometriosis. And for our categories here, there are two different pathways that have been elucidated to lead to the inflammation, specifically the IL-23 T helper 17 pro-inflammatory pathway that can occur in HS and endometriosis. But what I want to bring attention to here is that whether patients have high peripheral estrogen or low peripheral estrogen, there is an increase in the dysregulation and production of IL-17, which leads to the inflammation implicated in both diseases. And interestingly, in postmenopausal patients, high serum levels of T helper 17 cells and IL-17 have been present, which could further this inflammation along. So the limitations of our study were ascertainment bias by using electronic health record data. We are also unable to clinically validate these diagnoses and determine the severity of the disease in patients, the distribution of their disease, and also treatment. We're also unable to determine the temporality of this relationship. And our study design also determines correlation, not causation. But we hope that our findings are hypothesis generating and will lead to future studies that further characterize this relationship. So our main takeaways is that women over 60 years old with HS have a 2.62-fold increase in the odds of having endometriosis compared to those without HS. And we believe that hormone changes during the postmenopausal period may contribute to this relationship. But again, this is all theory, and we're hoping that future studies will further elucidate the pathway. And we believe that clinicians understanding this association will lead to better detection and recognition of both diseases in patients that otherwise may have gone undiagnosed. My references. And special thank you to my outstanding mentors, Dr. Anna Eisenstein and Dr. Jeffrey Cohen. Without you guys, I wouldn't be able to do this. And we also acknowledge the All of Us research program for the data.